Hello everyone and welcome to another episode of Ask Dr. Bob. Some very interesting and new questions. Somebody has a 17-year-old son. He's grown up quite tall. Scoliosis. He grew 8 inches. Scoliosis happens to be a severe curvature of the spine. Also mentioned that this young man had something called Osgood-Schlatter syndrome, which I have found from my experience oftentimes is due to lack of iodine or low thyroid, by the way. So for me to really make a comment about scoliosis, we would definitely need to take some standing digital films. But I want you to know this. When somebody has a curve in their spine, if their head has had any trauma and their head or neck, let's say had a blow from the left or the right and your head's like that, your body will readapt by changing mechanics. Have that young man's upper neck checked by a very skilled chiropractor or come to see us over here in Ohio. We have another question about a lipoma from the same individual. And what I have seen with lipomas, they're really fatty tumors. And oftentimes, if someone has a fatty liver, you're going to have a greater chance to have a fatty tumor because your liver has to process that. So you really want to pursue cleaning up that liver. Maybe some milk thistle, maybe some blood tests to rule out, and ask your doctor for some liver enzymes, and we do that for worldwide clients ourselves. This was a very interesting. Somebody was taking steroids for over 20 years and wanted to know what they should do, because if they skipped a dose, they started having some problems with dizziness and they have some tremors. Well, what I would suggest you do, if you could, you have to get off all the steroids for about 3 months, but you would be really wise to have an adrenal stress index that happens to be a saliva test. That helps us determine what kind of strategy we need to rebuild those adrenal glands. You want to stay away from sugar. That's really important. Here's a very first-time question in reference to a gene, part of the gene pool, with a marker called the HER2, which was positive. And this individual is having issues with breast cancer, and they wanted to put this person on some medication. And I know that the HER2 is a protein that stimulates the growth of breast and cancer cells. And I'm going to go back to the plan that I always suggest our practice members do. You want that liver optimally function. You want the thyroid gland optimally function. You want to make sure you have plenty of vitamin D. You may also consider having a urine estrogen test done. Those are just parameters that we do to help normalize function and keep those cancer cells at bay. Hi, Dr. Bob, I have ringing in the ears. What do I do? Well, I can tell you that in our practice, we oftentimes find those individuals may have low thyroid, subpar thyroid function. They may need some minerals. There's a product that I personally use called A-Emulsion, which has 12,000 international units of vitamin A in it. Just be a thought. Low thyroid for sure. Dr. Bob, what do you know about pink Himalayan salt? I want you to know I don't use it in the practice, and I really have never had anybody bring it in. I know there's a lot of information about it on the internet, so I'm going to kindly decline from making a comment. I'm sure it probably is a very wonderful product, but we use Celtic sea salt. Dr. Bob, I follow the ABC very strictly, but I crave chocolate. Anytime that somebody craves chocolate or a dairy product, I usually believe that they need calcium, protein, and fat. But I also want you to know when it comes to chocolate, you could have some hormonal issues. There's a book I read many years ago called Potatoes, Not Prozac by Kathleen Desmaisons. I read that book several times. So really a good tool to help you understand why you're craving chocolate. The bottom line is you need to get rid of it and break that cycle. Dr. Bob, I watch Marilyn Serra's program on the internet, and she happens to be from Madrid, Spain. We love this international marketplace that we're in right now. She wants to know about eating greens for breakfast, and here's what I'm going to suggest. Maybe saute some spinach with an egg, or saute any vegetables with an egg. Or you can saute any vegetables and throw mushrooms and onions in them. I mean, it's pretty simple, but usually either some kale, spinach, asparagus, you can throw some tomatoes in there if you'd like. any vegetable, either with an egg or without an egg, or grind up some chicken to have some extra protein? It was a very good question. You want that blood sugar to stay steady as they go. My name is Dr. Bob DeMaria, the Drugless Doctor.